Hello. The topic of my speech is how aspects of physical therapy can be used to better your life. How would you like to live your life joint pain free? To be able to train the way you want to train to old age? Well, listening to this speech may be able to help you with that. See, about 4 years ago, I started getting joint pain in virtually all the joints of my body. My neck hurt, my shoulders, my wrists, elbows, my spine hurt in three places. Heck, when I walked, my knees, ankles, and hips would hurt. And that was about when I got into lifting heavy, a little bit before that. I stopped lifting, and for about a year, guess what? The pain only got worse. So I went and saw a doctor. I got an x ray done and found out I have scoliosis, or an abnormal curvature of the spine. And this throws off the kinetic chain. This throws off the way the muscles work together, causes severe muscular imbalances and joint displacement. So I dedicated the next few years of my life to understanding the way the body works, the way the muscles work together to stabilize the joints. I read books, I listened to podcasts by physical therapists, I learned everything I could online, and I practiced moving in different ways for several hours a day, just trying to figure it all out. And now I'm going to school for physical therapy. And guess what? The past 8 months, I have been virtually pain-free. I've even resumed lifting heavy. Now, this is how the aspects of physical therapy can help you to improve joint pain and improve your life. In this speech, I'm not only going to go over these aspects, but how they affect joint health, how you can apply these to your daily life and even your workout routine and lifting. See, the true way to fix joint pain is to stabilize the joint through changes in muscular activation and movement patterns. The reason behind most joint pains, most joint injuries, is muscle imbalances. See, one muscle will dominate another and will pull the joint out of position. The joint will then cause damage to the surrounding structures. See, all muscles have muscles that oppose them. For example, the biceps flex the forearm at the elbow, while the triceps extend the forearm at the elbow. Those two muscles oppose each other. Same with the glutes and the hip flexors. The hip flexors oppose the glutes. And that's important because your glutes are one of the most important muscles in your body for stabilizing not only the joints in your lower body, but your spine as well. Now, when we sit, we naturally use our hip flexors. And what this does is, because it opposes the glutes, it stretches them out. It pulls on them, makes them weaker, until the glutes can no longer function properly. They no longer work properly. In certain cases, if it's bad enough, the glutes won't even work at all. And then when you get up, you start running, walking, moving, lifting, start doing ordinary things, start moving, the hip flexors will dominate that movement. Your glutes won't do the proper job. And this is bad because the hip flexors are small, weaker structures. They're not designed to be prime movers. They're just designed to be there for stabilization and to help support you when you just do things like sitting, non-active things. Now, because the hip flexors insert into the spine, the pelvis, the hips, and the knees, they can and will pull or push all of these joints out of position, causing joint pain and damage. Now, picture a game of doctor. That's much like how it works when a joint is pulled out of position. You don't want to hit the side or the game buzzes you, right? Bzz. That's how it works with the joint. See, when the joint hits the side of where it inserts, it'll start scraping the cartilage and shredding the tendons, fraying the tendons that are against the side of the joint and around it. It also reduces blood flow, which is important to the healing process and the recovery of the surrounding tissues. However, if the muscles are working together in the right way, the joint will be centered and stable, and it will not rub against the sides, and it will not move out of place. It won't degrade. Now, let's take your knee for example. The hip flexor, one of the hip flexors, the sartorius muscle, inserts into your pelvis and runs down to the medial or internal side of the knee. This is important because if the glutes aren't doing their job, then the sartorius will actually pull the knee out of position. Now, another important muscle is the long head of the hamstrings. This is another muscle that wants to work with the glutes and often doesn't, if the glutes aren't functioning properly, will go inactive. It's right here along the outside of the hamstrings. Now another good example to show you is the shoulder. Picture a steering wheel. That's the rotator cuff muscles. A steering wheel with two hands on it, one hand's pushing, the other hand's pulling. That's much how the rotator cuff muscles work together. Now if you're slouching, you're sitting forward, you end up activating the inside of the front of your shoulder, essentially. And just like the hip flexors do to the glutes, it pulls and stretches the back of the shoulder and causes your shoulder to move forward against the front of the shoulder capsule. The humerus, the arm bone, will then start scraping the inside of the glenohumeral joint, or the inside of the shoulder capsule. Scrape the cartilage and the tendons and reduce the blood flow, as discussed. Now, here are some points that you can utilize in day-to-day life for your exercises. The first thing I want to cover is breathing into your core the right way. Now, this is important because you don't want to be a chest breather like that. You don't want to do that because this throws off the kinetic chain. See, you're using your accessory muscles to breathe, the wrong muscles. You want to use your diaphragm. You want to breathe into your gut, stick your belly out, push against the abdominal wall, create what's called intra-abdominal pressure. Now, this is important to activating some of your larger, more important muscles designed for movement, such as your glutes. In fact, there are multiple case studies involved that prove intra-abdominal pressure is a key component to activating the gluteus maximus. So, breathing the right way, creating that air pressure in the right area is actually key to causing your glutes as well as other key muscles to work in the right way. The second point is good posture. Head up, shoulders back. That's important because the same muscles that keep your head up and shoulders back form a kinetic chain with your glutes, the posterior chain, which consists of all of the muscles on the back of your body. Now, another point is to grip the ground with your toes and your feet. If you're wearing shoes, grip the bottom of your shoes when you walk, or when you run, or when you pretty much do anything. You have muscles on your feet for a reason. Use them. They form a very important part of the kinetic chain, and it will help you activate those larger muscles that you need to be activated. Now, another important thing that you need to know is that one of the main things that doctors still use today is completely wrong. You may have heard of RICE protocol. Rest, ice, compression, and elevation. Dead wrong. In fact, the doctor that invented that, Dr. Gabe Merkin, recanted everything good he had to say about this protocol, recanted that it was a good protocol to use in 2015. And that's because there is now substantial evidence that this not only is an ineffective method of treatment for joint pain, but is actually more of a hindrance. It actually can delay or disrupt the healing process. This is because all four of those methods reduce blood flow to the affected area. It reduces blood flow to the joint, the tendons, the muscles all around it. Blood flow is a key part of the healing process, as we found. Also, inflammation. Inflammation is a very key component to the healing process. And ice, especially, is very effective at reducing inflammation. You don't want to do this. Instead, you need to move. As they say, motion is the lotion. Keep the blood flow to the area if you can. A lot of doctors will even say rest for a ridiculously long period of time, sometimes up to like 6 weeks. Another bad thing that you don't want to do, unless the injury is severe enough that you can't move the area. You want to try to move the area as much as you can in the right way so that you don't cause further damage to the tissues or the area, and that doesn't cause you too much pain. Now, I hope you've all gained more of an understanding and perhaps an interest in the principles I've discussed here. In conclusion, RICE protocol does not work, and rest is not a long-term viable solution. You need to be able to stay active to stay healthy, and the only way you're going to be able to stay active for the long run with healthy joints is an understanding of some of these principles, the way the muscles work together in stabilizing a joint, and apply these principles to movement by changing your movement patterns and muscular activation. I hope anyone here that hears this gains an understanding and interest in physical therapy and the fundamentals behind it. And furthermore, I hope this helps someone or some people. I hope this helps all of you improve your joint health and pain the way that it's helped me. Now, thanks for listening. Goodbye.